Welcome to the Sage Women podcast, hosted by Melanie White and Dr. Nick Engera. We have real conversations with real women, health professionals, and coaches who share stories about perimenopause, menopause, and a range of women's health issues. Please subscribe so you get the latest updates every fortnight.
It's Melanie White here on the Sage Women podcast. Super excited to have in the room with me Rajna Bogdanovic, who's a clinical psychologist, and she's registered in both Australia and New Zealand and has done a lot of work with first responders, frontline workers, and just helping people get unstuck. Rajna, welcome and thanks for being here today.
Thank you so much for having me.
I think, I've given you a really brief intro, but we'd love to hear a little bit more about you and your backstory, if that's okay.
Yeah, absolutely. So I'm a clinical psychologist and I run a company and am the founder of a company called First Response Health. So we work with corporate women and men in some of the big four consulting firms and big four law firms in New Zealand, but I haven't always been in New Zealand, although I am sort of raised in New Zealand. I was born in Croatia, and my journey into mental health, I guess, apart from uni, started when I worked for the UN. So I went from New Zealand, where I studied, to the UN, to The Hague in the Netherlands, and I worked for UN criminal tribunals. Yeah, so that was really interesting for a few years. I worked for some of the big ones, and then sort of realized that I wanted to be even more in the thick of it, and then went to Bosnia, where I worked with victims and witnesses of war. And of course, I speak the language, so that was a bonus. And then traveled to Sydney, so I had enough experience to then travel to Sydney, completed my master's, so I ended up getting into a university in Sydney that I really wanted to, and did some amazing placements and amazing work, including working for a prison and, doing some of that high trauma, high stress stuff. And following on from that, went and worked for Victoria Police. So I went from Sydney to Melbourne and became a police psychologist. And then following on from that, became the senior psychologist for the Country Fire Authority, working with firefighters. So my whole background has actually really been in sort of first responder, high stress, high needs, high kind of caliber mental health. And the mix, or the, I guess, transition from first responder work to corporate might seem strange, but actually there are many, many similarities. So yeah, that's where I am now. And I have a wonderful team. There's 10 of us. And we work across a large number of organizations. So that's us.
What a background. I knew a bit of your background from our previous conversations over the last couple of years, but I didn't realize the depth of it. So that's pretty amazing. It must have been very interesting to work in extreme environments, I would call them, with severe trauma, very different environments too.
Yeah, absolutely. I mean, lots of trauma, lots of potential for burnout for me. And thankfully that didn't happen, with lots and lots of self-care. But some pretty extreme environments, which at a young age opened my eyes and I guess created that sense that I can do anything, because if you can do that stuff, you can probably manage as a clinician in any environment. And to date, that has been so for me, which is good.
What a place to cut your teeth.
Yes.
So I know that this podcast is about menopause. I know that we've had a chat about that, and I'm really keen to kick off the conversation just to learn a bit about your experience in working with midlife women going through menopause or entering perimenopause.
Yeah, I mean, my experience has been a really great one, a really positive one. However, there obviously have been challenging aspects and some things that pull on my heartstrings, as you and I have sort of discussed, and some things that have created a bit of frustration for me. So obviously my organization works, primarily with very high performing women and men. And by default, these sort of organizations that we work within are very complex. And when it comes to things like menopause, can create complexities for individuals. So on the one hand, I've encountered the challenges that come with the societal stigma and shame and lack of awareness that's often associated with menopause and aging, which is, a really difficult part of working with women in midlife. But then I've also, amidst these challenges, had some incredible experiences with women of positivity and growth. And I've had the privilege, I guess, of witnessing the remarkable resilience that these women have to be able to navigate such a complex stage of life. So I guess ultimately my experience has solidified my belief in the need for greater dialogue and greater support structures around midlife women's health. And it's a real reminder that there's still much work to be done in both the public and private sectors to ensure that women move forward in this very natural life transition with more empathy, more dignity, and a really high standard of care. So it's been a mixed experience.
Yeah, and it's interesting that you're talking about the amazing, I think you would use the word transformation, the positive outcomes for some women. I'm interested actually to hear a bit more about that, because we don't talk enough about, or we talk, we go through the baptism of fire of menopause, but we don't often talk about the positive outcomes from that.
Well, it can be really quite transformative, and we might talk about this later on, but, you can sort of hope and or thrive through the symptoms in sort of adaptive ways or maladaptive ways, so helpful and unhelpful ways. And if you are exposed to, if you have the privilege of knowledge, and if you choose adaptive responses to this stage of life, it can be really transformative. You can gain self-awareness, become very healthy, and of course there's hormonal changes and things that occur, but you can, get to know yourself and the world around you, grow a deeper understanding of your body and your mental health, and I guess start to determine what this stage of life might be for you in terms of not just a work sense, but a personal life sense, what new challenges it's going to bring you, but also what advantages there are. But I think all of that, again, can be transformative if you have the privilege of knowledge and awareness, and also making that sort of choice, I guess. So
yeah, it's a good point. You can't make change without that first step of self-awareness and understanding. And why is working with women important to you?
Oh my goodness, so many facets to that question. I mean, women and women's health, of course, as a woman myself, I strongly believe in women and women's health, and especially in the field of clinical psychology. I get to support women in the interplay between physical and mental health. But I guess there's two elements to it. I guess there's the macro level. So women and women's health is fundamental to global health and development. And you have, all people understand this really well. So scientific research shows us that women's health outcomes are really closely linked to overall health indicators in societies, and women who are healthy have the potential to boost economies. They participate more actively in the workplace. Their children tend to be healthier. They, contribute more to stable and prosperous communities. And the World Health Organization, WHO, has repeatedly underscored that improving women's health is essential for achieving the Sustainable Development Goals, particularly pertaining to gender equality and poverty reduction and education. So that's kind of the macro level of why I love working with women and why women's health is so important to me. But at the micro level, the importance of women's health is just equally profound. I mean, women's health issues, including things like menopause or mental health or disease in general, has significant implications for quality of life in general for women and men. So for individual women, health is intrinsically linked to autonomy, the ability to make choices about their own lives, from family planning to career development. And good health empowers women to fulfill not just their personal aspirations, but to maintain those roles in their family and in society. So, the broader implications of women's health issues, are significant, if we don't take care of women's health. But, women often serve as primary caregivers, and their health status can directly have an impact and affect the health of, their children and family members and all of that. So there's all of those reasons why I think, women and women's health is important, but I think, we could go deep into economics, but, there's microeconomic impacts, which are also significant. A healthy woman is more likely to be productive and contribute to the household and therefore society. So I guess in essence, investing in women and women's health is not just a moral imperative, I would say, but it's really a practical imperative and strategy for societal advancement, quite frankly, because it really enables women to sort of live really fulfilled lives and be able to contribute on multiple levels of societal fabric. So yeah, I think it's vital.
Well said, Rana. I'm really looking forward to the Senate inquiry this year that is going to tap into some of those issues, and particularly thinking of Gen X right now, who are the ones in perimenopause and menopause, as the sandwich generation, looking after elderly parents, role modelling for kids, helping kids get through school and establish themselves. A woman's health to just perform those functions is so vital, in addition to managing finances and earning an income, and then also ensuring that the next generation is healthy and well through the role modelling process. There's a lot to think about.
Absolutely. Yeah. It's really multifaceted. It's quite complex. It doesn't, and I'm not saying that in sort of a fear mongering way. It's just complex. And if done well, can have quite far reaching impacts.
So what sort of symptoms would a typical client present with when they come to you that are related to menopause?
So I think it's really important for me to say, and this is just with the generation, or the I guess demographic that I work with, there are some typical symptoms which I will sort of present to you. But I think it's important to start by saying that many of the women I've worked with don't neatly fit the symptom criteria for perimenopause or menopause for so many reasons. So many of the women I work with, sometimes for a very long time, may have been kind of pushing down or sort of numbing, symptoms, or not acknowledging symptoms, or may not even know that they have the symptoms. And as a result, may feel like they're going crazy, or that they've just completely changed. And, before they realize there's anything happening. So I guess I just wanted to start with that often, women that have come to me don't neatly fit criteria. They don't sort of come to me saying, I think I've got menopause. Here are my symptoms. Yeah. They sort of may have a whole bunch of other stuff at play, which may be impacting their mental health. And then we sort of realize that it may be perimenopause or menopause. But in saying that, there are some themes. There are definitely common themes that women that have presented to me presented with present with symptoms. And so some of those are, I guess, primarily distress. So they may have, as a result of their symptoms, physical symptoms or mental health symptoms, report anxiety, irritability, angst, low mood, that kind of stuff. I then see, that women presenting sort of with, I guess you call sort of the secondary responses to the intensity of the symptoms. So they may have obviously some of the physical symptoms, the hot flushes, the night sweats, vaginal dryness, some of these things. And so it's the interaction with the physical that will then start to have a real increase in the, as I mentioned, anxiety and low mood, but things like fear and worry. And oftentimes women will then sort of report experiencing heightened stress and discomfort, maybe in their bodies also. So feeling kind of angry within themselves, or anxious or irritable within themselves and not knowing why. I guess moving on from that, there sometimes can be, as a result of all of these symptoms, a real fear of who have I become. So there's this real personality shift, and often that's as a result of, some brain fog and lack of concentration and not feeling as if you're the way you were before. So this kind of sense of who have I become. And I think it would be remiss of me not to talk about women in leadership too. So women in kind of leadership positions. It's interesting because there's kind of this source of distress there from the impact of menopause on, as I mentioned, sort of cognitive functioning at work and work performance as a result. And so things like brain fog or forgetfulness or lack of concentration, they may misread these symptoms as, I've even had people coming to me with sort of early onset dementia, thinking they have early onset dementia or whatever it might be, when actually it's sort of menopause symptoms. So those are some of the symptoms. And of course, there might be some very standard cookie cutter ones, but usually it's sort of a mix. And again, with some of these high performing women, it's usually quite some time before the realization comes that it's menopause. It's a mix of fear and worry and sort of pushing things down for a while before that happens.
I think I'm hearing a lot of intersectionality with lots of things that are going on for them at that time.
Absolutely. Yeah.
Yeah. And how do you find that those women are coping or dealing with persistent or difficult symptoms?
This is a really interesting one because we don't really have accommodations for women for menopause in the workplace from that I know of. We don't have too many accommodations. And so for women dealing with sort of very persistent or difficult menopause symptoms, this can be really debilitating in many respects. So because there's no menopause sort of leave, and many women feel like they need to then kind of take sick leave or mental health leave, even though it's not a sickness and not a mental illness, usually. This can really create, significant issues for the individual. So that's kind of that part, the fact that women sort of really struggle when they have persistent and difficult symptoms, usually. So I guess moving on to how they might sort of deal with it, there's two sides to that coin, I believe. There's sort of the adaptive or helpful ways, as we kind of mentioned at the beginning. So what are some adaptive or helpful ways that women, how they manage with persistent and difficult symptoms? And then what are some of the maladaptive and sort of unhelpful ways that women manage? And I've seen them both, unfortunately, and I've seen the whole spectrum. So when it comes to the former, the more adaptive ways, I've seen women really take matters into their own hands, which is wonderful, and attempt not only to understand the menopause deeply, but take steps to really manage their symptoms and, dare I say, thrive, as I mentioned at the beginning,
Yes.
And so
it's possible.
If possible, and it is possible. So how they've dealt with it, I've seen, as I mentioned, I've seen it all. So first and foremost, I've seen women obviously sort of immediately seek medical advice, which is amazing. They might do HRT, hormone replacement therapy or something like that. I've seen women deal with persistent and difficult symptoms by making lifestyle adjustments and lifestyle changes, which can be amazing. Adopting a more healthy lifestyle, regular exercise, balanced diet, stress reduction, all of those things. I've seen women, start support networks within their workplaces, which has been incredible, whether it's, sort of webinars and seminars or literal support networks where they kind of connect on a regular basis, which has proven really effective. And I've also, seen that women, can really go further in terms of their education by supporting themselves with, supplementation. So I've helped women, who are seeking referrals to get referrals to, doctors or naturopaths or whatever it might be, to seek supplements and alternative remedies to manage those really difficult symptoms. So those are some, and of course, being there for mental health support.
Yeah.
So those are some of the really helpful adaptive ways that I've seen women kind of manage some of their difficult symptoms. But there is, of course, the flip side to that coin, which is that there are some really maladaptive ways of coping, and I have seen these too. So ignoring symptoms, so not recognizing them or just downright downplaying them, can be really difficult and a hindrance, but that is a way to sometimes deal with difficult symptoms. Self-medicating, unfortunately, I've seen often. So when symptoms become so difficult, either using non-prescribed substances or even prescribed medication, but also, excess alcohol, excess caffeine, alcohol to unwind or to numb, and then caffeine to get through, which of course, we often crash.
The roller coaster.
Absolutely. Yeah, the roller coaster for sure. And I've also seen, emotional eating and of course drinking, but emotional eating in this case. Unfortunately, when symptoms become quite debilitating or difficult, withdrawing from social activities because of the symptoms themselves, which can, of course, exacerbate feelings of loneliness and depression. And then it sort of doesn't seem like a coping mechanism, but it really is, which is overworking. So diving into work to be able to deal with not just the difficult symptom, but to be able to then deal with the secondary issue, which is to compensate for the feelings of feeling less than, or to compensate for the lack of, lost productivity or lack of work.
Do you see that a lot, Rajna? Sorry to interrupt you, but I'm just really interested in the overworking, particularly in the space and the leadership space. Is overwork a go-to for a lot of women?
It's a generalization that I'm making, but it's an undeniable reality for so many women that I see. So I guess the answer is yes, it is a go-to for many women, obviously not all, but I definitely note, that I see many women feeling as if they can't concentrate for long periods of time, perhaps, or having brain fog or forgetfulness. And as a result, their day's tasks may not be completed in the typical amount of hours, or they may be more fatigued or whatever might be happening. And therefore they find themselves working into the night or in the weekends when previously they didn't need to. And of course, it's a sort of vicious cycle because they perhaps haven't told their colleagues what they're going through. Colleagues don't know that they might be struggling with all of these symptoms. So they overwork without anyone knowing, and then they're more tired, and then the vicious cycle sort of begins, and they're not having that time to rest.
Yeah, wow. That's tough. We make it hard on ourselves, don't we? And going back to something you said earlier about, you need to have that understanding and education in order to start making change.
Yeah.
That's often we hear that in SAGE, that women talk about menopause retrospectively and saying, well, in hindsight, I was probably in perimenopause and I didn't know. And there might have been a 3 or 4 year period where they were trying to understand what was going on, and they were doing those things that you've talked about, some of them being proactive, but others trying to smash themselves in the gym or to deal with the stress, or using more alcohol. Or I know a few people that have just totally withdrawn from all social outings for a couple of years. That's significant behavior.
Absolutely. And as you mentioned, sometimes they don't know it's happening, and other times they do. So perhaps they've gone to a clinical psychologist and they've gone to a GP and they're very well aware. But the perception of weakness, the perception that I need to prove my worth, some of the societal expectations of women and of youth, and that as we age and become less youthful, we are sometimes not as worthy or worth a bit less. And these are kind of big statements, but, our society has created some of these dialogues. And so I think there's a real striving to maintain a sense of your old self for some women, when they're going through menopause.
Yeah.
And so you maintain that through work and through being active. Yeah.
Yeah, it's hard to accept that your body's changing without your permission.
Yeah, absolutely. So there's a range of real adaptive ways that women cope and a range of real maladaptive ways.
Thanks for talking through those, Rajna, because I hope people listening to this might be able to identify themselves in some of those things and understand where they might need some support or where they're actually doing well. We don't often celebrate what we're doing well, but it is important to look at both sides.
Absolutely.
And I guess, this conversation about awareness and understanding kind of leads me into the stigma side of things. We all know that talking about menopause, there's a stigma around it, there's a taboo. What's been your experience with that, and particularly perhaps in male-dominated workplaces? What
we know is that, research indicates that, cultural attitudes towards menopause significantly impact women's experiences and perceptions of this stage of life. And in societies where aging is stigmatized and youth is sort of celebrated and revered, menopause can be seen as quite a negative milestone associated with, lots of things, loss of attractiveness and lack of capability, loss of femininity, all of those things. And this perception can really induce feelings of shame and inadequacy in women going through menopause. So I think there's that aspect, but we know also from the research that while many women feel shame going through menopause, many women feel shame not just for going through it, but actually just having the symptoms, which is obviously made worse when we have to hide them or feel stigmatized in just experiencing them. And I think I was mentioning also that we have research that speaks to the significant association between shame, stigma, and culture specifically here speaks to the fact that women experience high levels of shame and stigma when during, for example, things like when their sex life is impacted or when their intimacy is impacted, which we could argue comes from societal or cultural expectations of how we should operate as women. So I guess we're speaking about culturally in terms of the kind of cultural expectations of women and what we represent at different stages in our lives. And I think the topic of women in the workplace and women in leadership roles working in male-dominated industries is also a really important one. So I'm glad you asked me that question because, we know that symptoms or menopause symptoms may be a source of great embarrassment and vulnerability for women in the workplace and can make it a lot more challenging for women in male-dominated work environments. And, specifically, we know that working in male-dominated fields or working in male-dominated environments, particularly at high levels, can actually really negatively impact women's health in general and some health outcomes. But specifically for menopause, there can be some real negative impacts of working in male-dominated industries or male-dominated environments because of the increased stress levels that it brings, the fear of being judged, the fear of being different, being perceived as weak, as we discussed, and feelings of potentially constantly, being watched. And to add to all of this, the added pressure of all of this can make it really tough for women leaders to not just manage their menopause symptoms while trying to perform, but, trying to maintain some semblance of privacy while maintaining sort of that competitive edge at high levels in male-dominated fields can actually make it really incredibly difficult for women experiencing some of those, even more debilitating menopause symptoms. So yeah, tough time all around for women in male-dominated industries at times.
Yeah, I feel like saying not just at times, but yes, at times worse than other times.
At times worse than other times, yes, very true.
And I should say not all male-dominated industries are like that, but I think a lot of women would say that they've had an experience like that.
Yeah.
And then that makes me wonder, you've worked in a lot of different sectors, a lot of different countries. You've experienced working with women in midlife in many different situations and contexts. Is there anything surprising that's come out of that experience that you've had?
I think so. I mean, there's so many things that continue to surprise me in this area of perimenopause and menopause. And I think one of my biggest learnings, or one of my, I guess learnings you could say, is the real lack of knowledge. And it continues to surprise me. The lack of knowledge around perimenopause and menopause and its relationship to psychoneuroimmunology. Now, I'm not expecting everyone to know, what psychoneuroimmunology is and, how it relates. But for so many women, they still think it's just hot flushes and some other physical symptoms when there is an array of both psycho, neuro, and immunological challenges and changes that occur that account for so many of those kind of unseen symptoms. And I feel like more education is really needed regarding this. And again, I'm not expecting women to go and read about psychoneuroimmunology now, but the reality is it's not just a couple of the symptoms you've heard about maybe from your mum or your grandmother. there's really so much to it. And I think understanding the specifics can be really profoundly helpful. And I'll just give you a couple of examples. So, when we think about psychology or psychological factors, menopause contributes to increased levels of distress, as we've discussed. And this psychological distress can activate the HPA axis, the hypothalamic pituitary adrenal axis, resulting in elevated levels of cortisol, amongst others, which in turn may exacerbate other menopause symptoms such as hot flushes, mood swings, sleep disturbances. So that's just one example of, a psychological impact. And then we've got neurological processes that occur too. The central nervous system plays a real crucial role in regulating hormonal and autonomic functions in menopause. And so neurotransmitters like serotonin or norepinephrine or GABA are involved in mood regulation, temperature control, sleep patterns, all of which can really impact menopause, of course, or are impacted during menopause. So, disturbances in neurotransmitter balance can really contribute to some of those symptoms like mood swings and insomnia and cognitive challenges. So just, those are just some, neurological processes or impacts. And then, of course, there's the immune system function, which is impacted by menopause. So, menopause is associated with alterations in immune system function, including changes in inflammatory markers and cytokine levels, and just things like estrogen, which declines during menopause, has anti-inflammatory effects and often helps to regulate that immune response. So, reduced estrogen levels may lead to dysregulation of the immune system, resulting in inflammation or immune sort of activation. And when we have chronic inflammation, this has a real implication for the pathophysiology of various menopause symptoms. So, including joint pain and fatigue and cognitive impairment. So I guess I don't want to kind of go too much into the mechanism, but I guess my point in making all of that was that there's so many mechanisms that are involved, and it's quite a complex process. But I think the more awareness we bring to not just the physical symptoms, but the fact that it's a whole body change and a, life transition, the better we can acknowledge and then manage and hopefully thrive whilst experiencing those symptoms.
Yeah, well said. And leading on from that too, I've heard it being spoken that women going through the menopause transition in relation to immune function, we're seeing an increased rate of diagnosis of autoimmune conditions or the worsening of autoimmune conditions. So we really are at a crossroads in our health in terms of how do we deal with menopause, but in the bigger picture, this transformational time, how do we develop those more adaptive, healthy behaviours to counteract all of the changes that are happening on many levels in our bodies and minds?
Absolutely. And bringing awareness to how your body is responding, because every body is different. And if you can bring awareness to how your body's responding, as well as what really adaptive, positive lifestyle changes or other changes might be beneficial to you, the higher the likelihood that you are setting yourself up for some of those future potential challenges. Yeah.
Rajna, before we wrap up today, it's been really great talking to you and hearing your insights and experiences. What do you think some of our approaches need to be in terms of addressing the challenges of menopause, just from your perspective and experience?
Yeah, absolutely. There are a lot of things I think we could do, and I think we are slowly doing them, and I'm excited to see what the future brings. But I think there's a big change, which is a difficult one, but kind of at that macro level, I would love to see us addressing some of the cultural and societal factors. And there's workplace factors too, which I'll discuss, but I think cultural and societal factors, as I've discussed, can drastically influence the experience of menopause for women. Yeah. So I would love to see an open dialogue around women in midlife, and that although there might be challenges like menopause in there, women at this time are not less capable, less able, less worthy, just because they're experiencing a natural human life change. So I would love to see kind of this societal shift or cultural shift towards midlife women being just as,
Valued.
worthy.
Yeah.
Yeah. So
let's chip away at that behemoth.
absolutely. And it is a behemoth. So it's kind of, that's my big, hairy, audacious goal. So that's kind of where it's at. But, I would love also for us not just to take a biomedical lens, which is obviously very, very important, but for us to also look holistically at the discussion around menopause. And I guess what I mean by this is, while understanding the physiological changes associated with menopause are important, it's equally vital to really consider the psychological, the emotional, the social dimensions of the life transition. So there's more to it than just physical. So I'd love to see that. And I think, because menopause isn't a medical event in most cases, it's just a significant life change and can really impact women's identity and sense of self and relationships and overall well-being. So I think by broadening that conversation beyond purely biomedical, we can address some of those potential, speed bumps in the road. And I think from a work perspective, there's so much that I could speak about, but I think some of my top tips, if we could call them, for workplaces to kind of maybe consider changing, and these are just from the many women that I've worked with that would have benefited from some of these, is, I guess, in no order necessarily, but implementing really supportive policies. So creating policies that encourage or acknowledge, menopause as a significant, time in life. I guess offering flexible work arrangements if possible. Many workplaces already do this, but flexible work arrangements that are with privacy in mind, where you don't need to necessarily say why, but allowing flexible work hours or remote working. And of course, adjusting the workplace environment if possible to, provide for some of the symptoms of menopause. And I guess ongoing facilitation of dialogue. And so, encouraging open discussions to really reduce that stigma and support and sharing around menopause. And I think this has a twofold effect, which is that it can provide some resources for people, but it also educates people, which is so important. So the education of management and staff and that kind of stuff. And of course, once you've done all of that, preferably reviewing some of what you've done and whether it's working or not, and kind of continually assessing whether workplace practices are working would also be the best case scenario.
Yeah. And I love that you've covered the within and outside of work aspects, and thinking about culture. There is the workplace culture, and the things that you've described actually bring awareness and hopefully to start to normalize menopause and take away the stigma.
Yeah.
We spend much of our waking time at work, and that's a big influence on how we feel and how we respond to the world. And I think having those initiatives in the workplace and changing the culture there is a great starting point, because how else do you reach the masses? Well, TV, advertising, I suppose, public campaigns. But it seems to me, at least, to be a very significant opportunity.
It is. And in the absence of public campaigns and TV ads, workplaces are a great way to promote this and encourage ongoing conversation and behavior change. So, yeah.
Thanks so much for your time today, Rajna. Really loved having you and appreciate your availability for this episode. Is there anything else you'd like to share before we wrap up?
Thank you for having me, first and foremost. I really appreciate it. Love speaking about this and any mental health related topic, especially when it comes to women's health. I think I will just end on a hopeful note, which is that I think in our society, as we've discussed, we perceive menopause as this really scary time in life. And some of the women listening to this podcast may have heard some stories from, again, their mothers or grandmothers, but it really can be a positive time of life when women can thrive and peel back some of the layers of the onion of themselves and discover new parts of themselves. So I think I just want to end on a message of hope, because it doesn't all have to be bad news. It can actually be good news as well.
Yeah, and it sounds like seeking support can help to flick that switch.
Absolutely. Yeah. If you have the ability or the capacity within your workplace or environment within which you live to seek support from loved ones or colleagues, and of course professional support services like psychologists or doctors, that is absolutely the best, so that we can combat that feeling of loneliness, or as if you are the only one who's going through it, when really we know that's not the case.
Thank you, Rajna. Look forward to seeing you again soon.
Thank you.